On behalf of the board of the NIP, it is my pleasure to welcome you to the launch of this research fund for the NIP. I think it is indisputable that intellectual property rights have proprietary, financial and other benefits. But the question is really, how does one acquire intellectual property rights? You will agree with me that one way is through research and the patents that emanate out of that research that allows you to register intellectual property rights. And out of that property rights, one acquires the dividends, the proceeds, the profits, etc. Research and development leads to knowledge, invention, with the final spin-off being economic progress. And that is what we need in times when our economy is contracting by about 7.2% and we are projecting a recovery to around 2%. Charles Franklin Kettering, who was an American inventor, an engineer, businessman, and the holder of 186 patents, said, "Research means that you don't know, but that you are willing to find out." The NIP Act allows for research. That is one of our mandates, to conduct research in the areas of pathology of diseases and perform medical laboratory services relating to the occurrence, causes, prevention, diagnosis, or treatment of any illness, disease, or mental defect in human beings. At the inception of the NIP, we availed our premises to medical technologists for in-service training and internships. Over the years, we have facilitated the upskilling of technicians to technologists. We have partnered with the Namibia University of Science and Technology and other partners to develop the curriculum for the new medical laboratory sciences program that was introduced in February 2008. The NIP has also sponsored 4 medical doctors in the field of pathology, 2 of whom are currently in the employment of the NIP, while others have joined the private sector after having worked for the NIP for some time. Currently, there are 4 doctors whose studies we are sponsoring in the field of pathology. We expect 2 of them to graduate this year in July, another one in June 2022, and the last one in May 2023. Distinguished guests, ladies and gentlemen, the American National Science Foundation holds out 3 types of research and development, and these are basic research, applied research, and development research. The objectives of basic research is to have a fuller knowledge or understanding of the subject. That is, when me and you go to university, we do our undergraduate, we do some research here and there, so it gives us a fuller understanding of the subject matter at hand. It advances scientific knowledge without having any commercial objectives in mind, whereas applied research is directed to discovering new knowledge with specific commercial objectives in mind that are related to a product, processes, or a service. When you use the knowledge gained from research toward producing a useful device, systems, or methods, that is what is known as development research. And these are the areas that, with this fund that we are establishing today, that we would like to delve into, that we would like to empower Namibians, young Namibians, to go into the area of research, research the pathology, research diseases, come up with patents, register patents, so that we can become the holders of patents. And by doing that, we will ultimately contribute to economic development, skills development in this country, and assist in contributing to the aspirations of public health care in Namibia. Our vision is to undertake broad research and development into the area of pathology of diseases for the general benefit of our nation, the sub-region, and ultimately the world, because we believe at the NIP that we should not confine and restrict ourselves to Namibia, but that we should be able to show the world that we have something to offer and that we have something to contribute, especially in times when we find ourselves amidst a pandemic. We also plan to conduct some applied research that will lead to new innovations that will help the NIP in attaining its vision of being the laboratory service provider of choice. Ladies and gentlemen, I can say much more about research and where we want to take the NIP. But I would do a disservice to this great institution and the people that works for it if I do not mention that during the COVID-19 pandemic, which dawned on us last year, the NIP has mustered and went to the battlefront lines, and we have tested the lion's share of all the COVID-19 tests that have been done in Namibia, and we pride ourselves on having done that. With those few remarks, ladies and gentlemen, Mr. Gaisef, my CEO, allow me once again to thank you and welcome you to this inaugural, or the inauguration or the launch of our research fund at the NIP. We believe that this fund will contribute greatly to the aspirations of the NIP.
Research and development activities in health sector are crucial in ensuring that subsequent policy development and decision making reflects research-based knowledge and lead to better results. This is evident when we look at the international response to the outbreak of COVID-19. After COVID-19 was reported to the World Health Organization on the 31st of December 2019, WHO declared COVID-19 outbreak as a global health emergency on the 30th of January 2020. Scientists then met at the WHO Geneva headquarters on the 11th and the 12th of February 2020 to assess the current level of knowledge, agree on critical research questions, and find ways to collaborate in accelerating and prioritizing research. On the 11th of March 2020, the WHO declared COVID-19 a global pandemic. 9 months after COVID-19 was declared a global pandemic, WHO listed the Pfizer-BioNTech vaccine as the first such medicine to receive emergency use listing. Thanks to collaboration, research and development, a vaccine was found in a short period. Last week, on the 19th of March 2021, our Minister, Honorable Minister of Health and Social Services, Dr. Kanubi Shambula, launched the COVID-19 vaccination campaign. The Deputy Minister was the first to be vaccinated, as you all have seen. And I think NIP has just chose the right moment to launch their fund, as it coincides with the launch of the campaign. As such, we also need to research on what will happen once all of us are vaccinated. Because most of you are probably on social media and you see what funny things are happening when people are apparently vaccinated. So, so we have to find out whether it's really true or just people making fun of us. So as I officially launched the NIP Research Fund, I implore and invite stakeholders to support NIP financially or in kind for the medical research that will be undertaken by NIP. The support will truly go a long way. My wish is that NIP will cooperate and partner with relevant stakeholders, and that our scientists and students from different institutions of higher learning will be granted opportunities to be attached and be part of the research projects that will be undertaken at this institution. The current statistics show that even though Africa comprises 15% of the world population, but bears 25% of the global burden of disease, it produces only 2% of the world research output. So you see where the need is. Namibia is not exempted from this low research output. Support services that facilitate sustainable research is inadequate. As you all know, that our former minister was also one of the advocates of research in general. But as one of the institutions recently indicated that we will give, is it $1 million for research, which is actually just a drop in the ocean to compare what people are expecting from research. So, sustainable research, as I said, is inadequate such that our researchers are left to fend for themselves. These systemic problems facing African researchers can lead to brain drain, where they move out of the continent to contribute their knowledge elsewhere. We need to support the National Commission on Research, Science and Technology that has been mandated to coordinate research in Namibia, so that we can improve the health of our country's population through medical research and development that will improve the quality of life within the country. In conclusion, the Ministry of Health and Social Services welcomes the establishment of the research unit as a step in the right direction. The research unit will foster and drive research by collaborating with our universities and international collaborators to produce new knowledge on topics that are relevant for policy development to benefit public health. Research is a long-term investment, so it's a marathon, not a sprint. And we know from medical interventions such as ARVs that the fruits are rewarding. Thank you very much.
Mr. Geiser, thank you for coming here today. Our chairperson, Van Aesop, distinguished guest, we appreciate your presence, and I greet you this morning with delight, because this is a historical moment for Namibia and for NIP. Our chairperson spoke about our mandate of running research, which we have not been doing, and today is the day we've decided we're going to step into that direction. It's a significant occasion for NIP, and indeed a special chapter in our history. Part of NIP's mandate is to build capacity through research and development, and the establishment of this trust is perfectly befitting our mandate. When one talks about development without mentioning research, it sounds a bit disconnected or incomplete. The phrase goes by research and development, and the chairperson spoke about national development. Now, development goes hand in hand with research. If we don't research, we will not know. We will not be able to develop innovative and responsive solutions to our problems in the country. Research, therefore, is foundation to national development. As we launch the trust today, the intention is to foster and drive collaborative research to produce new knowledge relevant for policy development that will in turn improve public health. Gone should be the days for Namibia where we sit back and wait what are other countries saying about COVID-19, what are other countries saying about the vaccines, the responses to the vaccines. It should be history for Namibia because we have capacity in our country. Our chairperson spoke about the scientists that NIP has been training. It's really to create capacity within our country so that we are able to also produce and contribute to international literature. We strive to strengthen scientific research to become the epitome for detection of diseases, treatment monitoring, and support the expansion of laboratory programs aimed at alleviating public health ailments. It is our dream to someday to contribute to leading-edge medical research and international medical literature. We are very excited about this chapter that we are writing today. It's a chapter that goes a long way. It's groundbreaking for Namibia and NIP. Director of Proceedings, The world has been overwhelmed by COVID-19. It will almost be awkward for us not to speak about COVID-19, because NIP has been at the center of testing for COVID. The outbreak was unprecedented. In many ways, there was uncertainty, it was dark, we went on lockdown, but there are also positives that were brought about by COVID. For example, NIP today had to step up and establish a research arm so that we start doing research in our country instead of waiting for other nations to tell us what we should do in the space of COVID. Today, this moment, this hour, now, we've decided to step up and honor our mandate in terms of research. We might not have all the resources to go full-blown, Mr. Chair, even if we are launching the research trust today. The promise is not that we'll go full-blown, and that is why we will continue to solicit support from corporates. We are going to partner with universities, and we are going to source international funding so that our research take off and we contribute to our country. At this point, I would like to appreciate the support, unwavering support from the Ministry of Health. Mr. Geisert, thank you for coming and representing our ministry. We also thank the Ministry of Public Enterprises for support. We also have die-hard supporters, our partners, PEPFAR, Global Fund, the World Health Organization. They invest heavily in our work. We appreciate that. Their support is really priceless. We are equally humbled by the donations towards the research. The Director of Proceedings spoke about corporates, the pledging. There are really some corporates that already committed to support us, and I want to single out a few that already put a few dollars into our bank account. And that is the Motor Vehicle Accident Fund represented today. Thank you very much. Can we give them a round of applause? NAMDEP is also represented here. Round of applause to them. Dandi, they were unable to come. We also give them France Indongo Group also pledged. Bank of Namibia pledged. And NAMPOT. So that's the list that we have so far. We are very hopeful that we are going to enlist more corporates, more funders towards our research trust, so that our research really become more meaningful. I also want to acknowledge the presence of the media houses. The chairperson spoke about your partnership to NIP. We are really grateful because you take the word where we cannot reach. Like we are here today, we cannot be in Ushakati, but through the media partnership, you will take this to all corners of Namibia. Our team, NIP team, thank you. Let's continue to push boundaries. This is one such evidence that we have undertaken to push boundaries. I want to single out the team that really has been behind this event. It was sleepless nights putting this event together because it doesn't stop here. There's another event tomorrow that we are As the chairperson mentioned, we are inviting and challenging the young people to partake in the research that is to be undertaken. It's a challenge on you. Reach out to NRP, make contact with us. We want you to be contributing to the body of knowledge in this country. We have a lot of capacity. Namibia has over 60% of young people, and we believe that we can really take this country to another level. As I conclude, Director of Proceedings, I would like to remind Namibia that tomorrow we are hosting an online conference titled The Ongoing Lessons from COVID-19 Pandemic in the Health Sector. We are going to unpack lessons from there. So please log on, go to our website, on our Facebook page, so that you get the link there. and please partake in this event. At this point, I would like to thank you for your presence. I thank you for being here. I thank you for being part of our new chapter, and go well. Thank you.